Okay, can everybody hear me okay? I guess I was on mute. Can you hear me now?
Yes.
Okay, awesome. So we're going to be talking today about cultural humility and practicing that as a community health worker. I think that cultural humility is all around us, but we may not even know what it is or how to categorize experiences we have in life as cultural humility. So we'll go ahead and dive right in and get started. So we're first going to begin by defining what cultural humility is. It's basically the ability to maintain an interpersonal stance that is other-oriented or open to the other in relation to aspects of cultural identity that are most important to the person. So putting that into like simple terminology, it's like when you meet someone for the first time and you don't really know them personally, but you know about the struggles of their culture. Like you might meet someone Jewish and you know about the Holocaust and all the things that they endured. Or even bringing it down to an Alaska level, you might live in a rural area and know about specific struggles that a tribe has had or issues they've faced in the past. So cultural humility is basically knowing your audience and delivering information to them in a way that will be received well. And it's also about removing yourself from the equation, like your personal beliefs, your opinions and biases. It really comes into play with this work because we work with so many different people that will need our undivided help, and we just need to be able to put ourselves in a guide and best assist our clients to the best of our ability, basically. And it also states that it's an approach to providing services to client communities with an awareness of history, current dynamics of power, and privilege. It requires that you not impose your own beliefs and biases. In turn, this will help eliminate assumptions about people we work with. So, you know, there are all kinds of assumptions out there, especially when it comes to health insurance. Unfortunately, in our day and age, something that should be very easy to access and readily available has so many political implications tied to it, and people, you know, maybe you've met, and I know I've met, who say, I don't want to apply for Medicaid. I don't want to feel like I'm sucking on the system and things like that. So sometimes people are aware of these biases and almost, in a sense, discrimination that they experience out in the world. And so it's just making us super aware of that and then doing our best on a professional level to be sure that we're not doing that, because our job is to help people and to listen to their needs, not to impose our own beliefs and biases on them. So moving on to the next slide. So how could we practice cultural humility? It's a building process. It's important to study the histories of oppression and discrimination, examine our own biases and prejudices. We always want to engage respectfully with all of our clients, and we also want to engage in some self-reflection and self-critique. Maybe you've met with someone and something about them you just didn't like, and you weren't even sure why, but they rubbed you the wrong way, and in return you rubbed them the wrong way, and then you reflect after that meeting and think, I wonder what about them bothered me, or what did they say that triggered me to have this negative kind of feeling towards them? So we always want to engage in self-reflection and self-critique. Believing that all cultures are equal is huge when practicing cultural humility. We all come from different backgrounds and have different beliefs, and different things are normal to different groups of individuals. So we just want to do our best to have an open mind, an open heart, an open ear to clients we're assisting. And we need to learn to be comfortable with other cultures. We need to, understand that what they believe is what they believe, and what they value is just as valuable as things we value in our culture. And so we also want to recognize and empower our clients to talk about their life experiences. Their culture and life experiences might be, one of the reasons they think the way they think, or they don't go to the doctor, or they, avoid taking their prescriptions. It's just really important for us to learn about each client as much as we can, and then cater our approach to them accordingly. So we also, like I said, want to place our assumptions aside when working with others, because it's really just going to get in the way. That's one of the most difficult parts, in my opinion, about practicing cultural humility, is just putting aside maybe a bad experience I've had. Also, just, sometimes people confirm your biases, and then you're like, oh, I knew it's not shocking they did that, because that's what they do, and that kind of attitude and behavior just isn't really helpful. And you have to remember, as a community health worker, you are a patient advocate, and people trust you and come to you, and the way you respond to one person, 10 other people might find out about. So it's important all the time to do that. So that's what I can say about practicing cultural humility. It's an ongoing process. It requires lots of self-reflection and patience with other people. So let's talk about a word of caution. We want to note that there is tremendous diversity within cultures. So you might meet people that have different extremes, different beliefs, but still the same race. And that might be like, oh, so well, one person's doing this and the other person has completely different beliefs. It's a continuous learning curve, and you will just need to be more of a listener so that you can identify where individuals are coming from. And so know how to identify cultural norms, challenges, and power differences. I guess we're going to get into this a little bit later in the session today, but we all, I'm sure, have had personal struggles with power differences and challenges that we experience in our day-to-day life. So just know that people you're reaching and you're working with also have those struggles and biases and things stacked up against them that they're battling with. So if we can come from a place of relation, I can relate to you, I don't have your same struggle, but I have my own, and it's similar, and we're just going to work towards going onward and upward. That is a more positive approach when we're dealing with our clients. So that's just one thing I wanted to point out on the word of caution, is just to do your best to respect all the different folks you see. And if you're in a community and you have a transient group of people that come in and out maybe, and you haven't really taken time to learn more about them, maybe getting to know them is worth your time, and some goal setting you can do, oh, well, I know this group of individuals only lives here a couple of months out of the year. Maybe I should get to know them more, type of thing. So we're going to do some goal setting today and talk more openly as a group about cultural humility, and then catering a plan in our own health center. So extremely effective CHWs practice the learn model. So the first thing you want to do is listen with sympathy and understanding. Explain your perceptions of the problem. So someone tells you why they're there to see you, then you're going to repeat back to them, okay, so I understand you're coming to see me for X, Y, and Z, and you're experiencing difficulty in these routes. You're going to acknowledge and discuss the differences and similarities between the perceptions of the client and CHW, because what we hear may not always be what people mean to say, or it might not articulate, like what they're saying, you might not be receiving as what they mean. So it's important to have open communication and say, well, as I understand it, you're going through this and you need this. And then they say, no, well, that's part of the problem, but the other half of it is this. So it's important to really be a good listener, repeat back what you understand, and then acknowledge any differences or similarities. They might say, oh my gosh, yes, you hit the nail on the head. That's exactly what I've been going through, and that's exactly why I'm here. And so then from there, you can recommend resources and know what resources exist in your community, and negotiate, agree, and then end your meeting with them. So this is a great model, and it helps you to help with all sorts of different people from all different backgrounds and cultures. So roles of the culturally effective community health worker is cultural mediation between communities and health and social service systems. So an example of that would be, say you have folks coming to see you about getting on some sort of WIC. Say people come to you, they want to sign up for WIC, they've heard it's a program, they don't really know much about it, and say they're not from the U.S. They're just recently moved here from their country, and they want to learn more about these services. So when they describe the age of their children and maybe their income range and what they're struggling with, getting food, etc., then you want to be able to have the knowledge to provide them to these health and social service systems such as Medicaid, SNAP, Denali Kid Care, whatever other programs are out there in your community. If there's heating assistance or anything like that, knowing about the food banks. If someone is coming to you and it's a very private matter and say they've experienced domestic violence, you would want to be able to refer them to your local women's shelter. And it's really good to have a warm handoff with these social service systems and knowing all of the organizations in your community and kind of building like what I would call a web, like client, healthcare services, Medicaid, food stamps. Like having a go-to person seems to be a quicker way to have success with directing folks. There's nothing better than being able to tell someone, so well, when you get to the office, ask for this person because I work with them all the time and you'll be well taken care of. So that encompasses providing direct services and referrals, and then providing culturally appropriate health education and information. I'm not sure if any of you, some of you probably do know this resource, but marketplace.cms.gov, they have all sorts of insurance and health education information in different languages that you can have available at your fingertips. I think you need to create a username and password to gain access and order materials. But you also might have a language line at your organization where if you get folks in the door that don't speak English as a first language, you can use the language line. And by chance, if you guys could do show of hands, do you guys in your clinics have the language line or some sort of interpretation service? If you don't speak the same language as your clients, if you could just show by raise of hands, I would love to see how many of you know of that service and then have it. So looks like quite a few of you have it. Great. Thanks for letting me know. And if you don't have like a language line, you might want to check with like your clinic administrator because usually all public health centers have that set up to an extent. It's like a required deliverable. So if you don't know for sure, just double check, and then in double checking, ask how you can learn about the resource and use it for clients. That's practicing cultural humility, being prepared for something that hasn't even come your way yet, or maybe it has and you just didn't effectively deal with it in the past. So thanks for your show of hands, guys, on that. So then another effective way to be with your clients is to advocate for individual and community needs. If you see an ongoing struggle or something that you've identified is going on that's more commonplace and it's not really good, is speaking up for those people and having that voice within reason. I don't expect anyone to put their neck on the line and compromise their employment by just jumping ahead of their organization, but if you notice some wrongdoing has gone on and people have disclosed that to you, knowing your next steps to advocate for them, even if it's a friendly pass-off to the right person, just having that in your back pocket is really important. And then assuring that people get services they need, that's the most critical part of being a community health worker. One of the most critical parts is connecting people to services that they didn't have before or lost touch with or didn't qualify for. So knowing how to connect people with services and assuring they get those is huge. And then it says building individual and community capacity. So on a broader level, you're part of a care team, getting with people in your clinics, letting them know, you know, your specialized work with the community health worker, finding out if there's initiatives that are going on, like reducing blood pressure or it's breast cancer awareness month. It's really being engaged with your clinic and also with folks out in the community and kind of like bridging that gap so that they realize you guys really are the ultimate resource, not only for I'm sick and I need to see someone because I have a high fever, but really for I want to keep up with my annual exam, I want to, you know, do a yearly physical, I want to feel good, I want to make good decisions, and it's more about preventative help, letting people know that healthcare isn't always reactionary. It could be preventative. So really building that individual capacity is really huge. That's why community health workers are so up and coming and new with this movement of just taking better care of our health and accessing the 10 essential health benefits that are now out there for people. So that's important for us to know as effective community health workers, what people have access to, how they can access it, and then how you can bridge the gap if they're experiencing any sort of difficulty with accessing services. So before we jump to the next slide, I would like to get some participation either by phone or by chat box, but can you guys think of some services, if you haven't already helped folks with, but what you see your ultimate role in helping people connect with in your community? And someone volunteer as far as telling us what services you plan to connect your clients with as a community health worker? No volunteers? Suriani says awareness to the SNAP program. That's a good one. Karen Johnson says, I would love more clients to pursue Department of Labor programs like NCRC. Huge, connecting people with job centers. That's part of apprenticeship. You know, there's tons of apprenticeships everywhere in our state, and knowing how to help them is huge. Suriani says not many of the Medicaid patients who are qualified are aware that they are qualified for this program. Yeah, people don't know what they don't know. So knowing those qualifications as soon as you meet someone, like internally, helps trigger like, oh, said X, Y, and Z, and actually you qualify for these things. So any other services? Karen notes that the Medicaid backlog is horrible. Yes, it is. Please use healthcare.gov if you're not already, Karen. Not saying it'll eliminate all the problems, but it might help a bit. Esther says Medicaid, Medicare, and VA. So lots of health insurance help there. What about, have any of you helped like victims of domestic violence or people that are maybe rehabilitating from alcohol or drug abuse? Are those services that you guys could see being useful? Or even suicide prevention, if people are in distress and they're thinking of taking their life, do you know your local resources of how to get them help? So thanks to those of you that participated, and just some of the ones I mentioned are just a well-rounded group of items that you might encounter when you're helping someone. And then aside from those services, also knowing when people get diagnosed, like with cancer, breast cancer, knowing those support groups is huge too. Or maybe they have lost, maybe their child died. There's all sorts of support groups in our communities, and we just have to know where they are and how they fit in. And then Suriani says, yes, USAFC and some of the local community here does counseling as well. Yes, know your counseling services, because honestly, you might meet people that just need a hearing ear and someone to talk to because they're going through something very stressful in their life. So I think we're gonna, have an activity in the very near future where we map out our services in our communities and how we can access support groups throughout the state. And yes, Katie, I'm hoping that you guys can help me put together this comprehensive list in your communities so that like from A to Z, from food to women's shelter to, my client just got diagnosed with terminal cancer, I need to know what to do with them, type of thing. So one more comment in the chat box. Lindsay says, in Kenai and Soldotna area, we have an interagency meeting once a month, except in the summer, where we talk about the resources available in each agency that participates. It's super helpful. Yeah, so if you guys have those kind of meetings in your community, I would highly encourage you to put your business cards in your pocket, get out of the office, let your boss know you're going to do some community capacity building, introduce yourself as a local expert, and let them know all the different types of people you encounter and would love to refer to them. So that's a little homework. I'm going to create a list of statewide resources, and then if you guys on your community level by next class could create a list of your local social services in your state, or I'm sorry, in your town, we can come together and cross-collaborate and see what we each come up with. And this is work that you will need to do anyways as a community health worker, is to have a robust referral network. So next time we'll focus on what services there are and what you guys find.
Yeah, Will came and replaced some power box on it.
Okay, so moving on. So this takes us to the self-reflection and next steps. How will you practice cultural humility in your day-to-day work? And folks, you can either type this into the chat box or speak freely, but I'd like to know how you plan to practice cultural humility as you go day-to-day. Examples are fine. It doesn't have to be factual stuff you're already doing.
Check it out.
Any takers? Okay, well, we just went over quite a bit about practicing cultural humility. But some folks are chatting in, so let me do that. Esther Bennett says non-judgmental listening and unbiased. That's really easy to do initially, and it's not a lot of list building. Esther, thanks for pointing that out. Lorna says STA treatment, slow down, be present in entirety, ask questions, and really listen. Very good advice. Yes, we should. Karen says, I recognize that time is not as important in some cultures as it is to me, so maybe if a patient comes a little late, you don't really scold them and say, oh my God, your appointment started 15 minutes ago and you're late. So that's good to point out there. Suriani says, being aware of the different groups in this community. Yes, that's huge. Get to know your environment and the people you're serving. And think outside the box and get outside of your comfort zone. That's how you can practice cultural humility in your day-to-day work. And then knowing how to access interpretation services. Should you meet someone, should they come into your clinic and English is not their first language, that's huge. So what are gaps or challenges you would want to work on in your community as far as cultural humility? Where is deficiency, do you guys think? And this is a friendly place, so as long as we're respectful to everybody, we can certainly talk about things that bother us. Well, one example that someone gave earlier was about connecting people to job centers. You know, we often in our work encounter people who might not be employed and who might have, you know, had a job in the past, but they're looking now. You know, I would like to encourage everybody to learn more about the job center and really even having a connection there, so that when you meet that person who is just down on their luck, want to get started back to work but don't know the first step or are feeling very discouraged, even doing a little bit of counseling in our work, I think is huge. Lillian says being courteous to everyone. We do not know what they're going through at the time. Exactly. And being nice and friendly and having a loving demeanor helps people open up to you and not feel, you know, judged. And oftentimes people are often going through a stressful time on their own. And so if you can kind of be those arms around them to say, you know, I'm here to help, I want to listen, tell me your story, that's definitely helpful. And then Suriani says self-reflection and self-critique. I would like to be able to set aside time to do this and recognize my weaknesses. Yeah, it's really hard, you know. I know as, you know, a woman personally and as a woman of color, you know, I've gone through struggles in my personal and professional life where I've just been blown away. And, you know, I think to myself, wow, people think this stuff doesn't exist, but it does. And oddly enough, I want to believe it doesn't exist, and then it slaps me in the face, and I'm like, oh my gosh, this is still happening. Like, you know, people are still struggling as women in the workplace. They're still struggling as minorities. You know, there's this class divide. And so it's knowing all of that and being very aware of all of those struggles and helping people overcome.
Good afternoon. Thanks for calling Furniture Community Health Services. My name is Kelly. How can I help you?
So, um, So what I'd like to do now is think about 3 actions that you will take by the end of the community health worker apprenticeship to strengthen your capacity to work across differences of race, class, culture, and language. What could you do to immerse yourself into a new group of individuals that you maybe haven't touched before? How can you learn more about people in your community that you know they're there, but you don't know a whole lot about their culture or beliefs? Tell us 3 things, and if folks, you could type this in the chat box, that you would do by the end of community health worker apprenticeship to strengthen your cultural humility. I'd love to hear that. And if you can't do all 3 right here on the spot, that's fine too. You can always incorporate that in the services homework we're going to do. But are there any examples of what you can do to strengthen your work to help people in different cultures? Kelly Wright. Let's see here. Getting more in tune with people struggling with treatment, more involved after hours and call-in, sharing my workload with coworkers. Yes, that's good, Kelly. Anybody else have 3 actions or an idea of some capacity work you can do to prepare yourself? Eating together. Oh, yes. Esther Bennett says, besides race, class, culture, I need to work on the generational cultures. I know, right? Because this social media stuff is like a whole new world, and people just don't even really have relationships the way they used to anymore. Like, you just post something on Facebook and that's your life there. So knowing about that is helpful, how people effectively communicate. Lorna says, spend more time visiting with people of different cultures. Yeah, maybe if you notice they're having an event, you could go by and introduce yourself and let them know that you're a resource in the community. Great idea. Some of you might be religious and go to church, so not on your personal time, but on your personal time, making those connections with resources that are church related, like knowing the pastor and knowing where you can refer someone if they need extra help. That's also something that you can do to increase capacity. Some communities is huge. People go to church every Sunday and like the whole community is in church, and then, you know, it lets out. So knowing that. Lillian Ford says facilitating cultural dinners to get to know people and learn more about their cultures, craft classes, invite them to our regular meetings. That's good. And then also, guys, if you have kids in school, some nights they have events where it's like math night, and like I know in Anchorage they have like Polynesian cultural night, and they have all different kinds of things. So if you can insert yourself in those events, that's helpful for you to get to know people. Kelly Whitmore says, study the cultures in this area and be open to what their needs are, helping different cultures navigate the resources available in that area they live. And that's huge. Making those connections and knowing the audience you're dealing with, things that they might struggle with on a whole basis, and then being prepared to already help them with that. If you live in a fishing community and folks are having hardships during a certain time of year because they're out of work, like knowing these sort of things, and maybe even having a calendar of events that you can not only have personally but share with people is helpful. Great. Well, thanks everybody to those of you that participated in our self-reflection and next step. We're going to be building this comprehensive list of services, but I've got a video that I'd like to share with you guys now. And it's not too long. The first video is pretty long, but I want to just show you this one for now.
Hello, my name is Abby Hinton, and I'm an instructor at City College of San Francisco, and I'm really excited to talk to you today about cultural humility. This is a topic that, in my opinion, is one of the most important ones for you to be successful as a community health worker. Now, some of you may have heard about cultural humility in the past, and others may have heard the term cultural competence. But we have found in this field that cultural humility is the term that's most accurate to the work that you're going to be doing. Cultural humility is a way that you can really learn to gain respect of working with clients because you're respecting them. It's a way for you to understand and demonstrate your compassion. And this is a very important dynamic that traditionally in our biomedical approach, it's generally been thought of as we look at the doctor-patient relationship, that the doctor is the all-knowing one, all-expert. But it's the client or patient who really knows the truth about themselves. So we shift that dynamic, and it's the client who knows the story. So therefore, they're the experts. And as Maya Angelou has once said, it's not so much what you say, but it's how you make people feel. And if they feel listened to, they feel respected, there's an increased chance that they're going to come back to see you, and you're going to have gained their trust. So I encourage you all to think about cultural humility not only as a one-time shot of reading in the chapter and discussion in class, but ongoing. And the most successful community health workers actually are those that embrace cultural humility as a lifelong concept and a fundamental value and skill that will take you to the highest roads of success. And I love working in cultural humility. I myself am learning about it constantly in this diverse world, but that's what makes this work so exciting and so dynamic. And I encourage you all to embrace it fully.
Okay. So we're just going to listen to the next video. We're not going to do the whole 30 minutes, but she really lays the foundation for learning about how cultural humility works, and it's kind of more of a how-to guide. The video we just watched really just talked about the warm and fuzzies of why it's good to practice cultural humility and how it's an ongoing process. But this one is more of a how-to guide, and we'll just watch maybe the first 10 minutes.
You need a website. Why not do it yourself? With Wix, you can create your own professional website.
And what did I say?
9192
But a band who
as a pilot. And
the colors.
what was the writing
Right,
thing with
but-
that? I thought that was 90. It was provoked.
Sorry, guys, we had a mix-up with several things going.
One word to describe cultural humility for me is is love, actually. If I had to encapsulate cultural humility, the whole concept of cultural humility, it doesn't do it justice, but the word that I think of it is essence. It's escuchar.
You.
Opening.
Receive. Compassion.
Love.
The principles of cultural humility offer one more framework to contribute to what has got to be our ultimate goal. Yes? Our ultimate goal is that there will be a sense of equity, a sense of equality, and a kind of respect that we are driving forward.
Cultural humility is a multi-dimensional concept, and certainly Melanie Tervalon and I conceptualized 3 dimensions.
The first is lifelong learning and critical self-reflection. And in that critical self-reflection, it is the understanding of how each of us, every single one of us, is a complicated, multidimensional human being. Each of us comes with our own histories and stories, our heritage, our point of view. You're looking at me now. I am very fair-skinned. When I was a little girl, my hair was blonde. My eyes are blue. People often try to call me anything but African American. I have a history. My identity is rooted in that history. My parents gave me the knowledge of my own social identity and my own experience in life has created that. I get to tell you who I am.
The second tenet, after self-reflection and ongoing lifelong learning and development, is this notion that we must mitigate the power imbalance. So recognize and mitigate the power imbalances that are inherent often in our clinician, patient or clinician client or service provider community dynamic.
And then finally, the piece that I would offer that Jen and I feel people often either don't read or don't like, which is, and the institution has to model these principles as well.
An African American nurse is caring for a middle-aged Latino woman several hours after the patient had undergone surgery. A Latino physician on a consult service approached the bedside and, noting the moaning patient, commented to the nurse that the patient appeared to be in a great deal of post-operative pain. The nurse demandingly dismissed this perception, informing him that she took a course in nursing school in cross-cultural medicine and knew that Hispanic patients overexpressed the pain that they're feeling. The Latino physician had a difficult time influencing the perspective of this nurse, who focused on her self-proclaimed cultural expertise.
It was curious to this Latino physician who, first of all, was Latino. Not like all, in his case, not like all Mexican Americans know everything there is to know about Mexican American patients. That wasn't it, but he might have been a resource for that African American nurse in that moment that she didn't feel like she needed, again, because she had bought into this notion of competence, of cultural competence.
The distinction between cultural humility and cultural competence was that we were in a process and a relationship that had many other layers to it, and that we were less comfortable with with even the term of competence.
in a way that I think people understand well, and that it implies, especially for people who are providers and are trained in academia, that you are then all-knowing and all-powerful. And we felt like that was not what was happening for us as we were learning from community and understanding in a very practical way how families were coming to the hospital and feeling as if they really were not being heard from their own heritage and history, and how that impacted what they came to the hospital with that we didn't know anything about, hadn't even a clue about. For us, this is part of the humility piece of it, getting to understand that I'm not trying to humiliate you, I'm not trying to make you feel bad, I'm trying to help us all understand that life is like this, and to, in a certain sense, be really happy about not knowing.
In April of 1992, in the wake of the Los Angeles riots, following the initial not guilty verdict of the police officers accused of beating Mr. King, the Children's Hospital Oakland community was compelled to meet in a series of highly charged sessions to expose and critique our own patterns of institutional racism, injustice, and inequity. My name is Dr. Melanie Turbalon, and I am Director of Multicultural Affairs here at Children's Hospital Oakland.
I want to thank everybody for coming to what is a celebration for me of this year.
Jan and I had the good fortune, really, to be together in the same place when this work was evolving. Jan and I, while we are several years different in age, are both African-American women, and both raised by women who were teachers. And we've come out of that, and fathers who were working men, who come out of that Southern tradition and who participated fully in the civil rights movement in a way that meant that they made sacrifices and their children made sacrifices, and they taught us about those sacrifices and raised us each in ways to understand that we were here to serve.
So that's a great video, and I'll circulate this PowerPoint around to you guys following today's webinar. But I think the biggest part is, you know, like she said, it's a lifelong process of learning about different people and cultures, and every day you'll probably learn something new about someone you didn't know before. It's really observing our biases and knowing where they come from and putting them to the side, and then it's working to know about the biases and institutionalized discrimination that people encounter, because you having that knowledge as a community health worker will help you help your clients overcome obstacles. If you're not aware of things that people go through on a regular basis and services that they may try to access and constantly hit a brick wall on, it's really difficult to empathize and then to come up with workarounds, because our ultimate goal is to be successful no matter what we're doing, and to make sure our clients are successful. So really, I would encourage you to educate yourself about the people around you, about their struggles, about their history, and then also about yourself. Where do you come from? What's important to you? What struggles have you had? And how can you take your own personal history, embrace it, protect it, put it in its place, and then be open to the experience and beliefs of your clients and deal with that in a very tender way. So ultimately, that's what cultural humility is. Cultural humility is all those things. It's a lot of work, and whenever you deal with people, and it's not in a generic way, like you're just not providing a clear-cut service like making them a burger at McDonald's or whatnot. You have to get in the weeds of this, and it can get uncomfortable and it can be a little strange, but I know that you guys are the advocates in your community, and you are doing already so much work to link people to different resources and services. So we can only get better from here, and we will be working together to build on what we know and to better serve our communities. So I'm going to do some self-reflection too after this class and think more about what I can do to help you guys practice cultural humility, how we can incorporate what we've learned today into all of our sessions moving forward so that we are the most prepared we can be when we're meeting with clients. So we are right at about 1:52. Was there any questions or parting thoughts before we conclude today's class? Well, okay, we are moving on, I believe, to Chapter 7. I will circulate this PowerPoint to you guys along with the recording. If you haven't already turned in your logs, please do so for May, your on-the-job logs. That would be great. And then I will send an email about the little extra homework on service, our service worksheet we're gonna start working on, because that's a little bit of a process. And then we'll just join together next week at 1 p.m., which will be June 12th. Wait, today's June 12th, right? We're going to join together on June 19th. And I'll see you guys back here at 1 p.m. In the meantime, if you have any questions or need anything, reach out. And I'll look forward to hearing your plans moving forward about doing your own self-reflection and building capacity for cultural humility at your workplace. So thanks again, everybody, and that will conclude today's class. Take care.